Doctor, my hair is thinning. I can see some gaps in my hairline. My hairline is receding. Bald patches appearing. What should I do? Doctor, I am aware about finasteride, but I am really scared to take it because I've heard so much from the internet. It has got a lot of side effects. What do I do? If you are somebody who's thinking like that, then this video is for you. To understand the side effect profile of finasteride, you need to understand the molecule first and what does it do to your hair. So let us understand what is exactly happening and what is finasteride doing to your hair roots. So hair roots, also called hair follicles, is something like this. So the hair is becoming from thick hair to medium-sized hair to fine hair, and then this hair is falling and it is converting into fibrosed follicle. So what is happening? Testosterone hormone gets converted to dihydrotestosterone by the enzyme 5-alpha reductase. Right? So this DHT, the dihydrotestosterone, is going and sitting here. It has receptors here. So it is going and sitting in the receptors and signaling the hair to become fine hair, and one day it is lost. So what your finasteride is doing is inhibiting the 5-alpha reductase enzyme, and hence the conversion of testosterone to dihydrotestosterone is reduced. So this is what we saw. How finasteride is blocking 5-alpha reductase, and hence it's called a DHT blocker. Now, finasteride doesn't inhibit the conversion of testosterone to dihydrotestosterone to 100% extent. There is some percentage of conversion which it is stopping from testosterone to dihydrotestosterone, and hence the suppression of dihydrotestosterone is not that much. 1 milligram of finasteride can suppress up to 60% of conversion. So now let us talk about the side effects of finasteride. So the notable side effects of finasteride are weight gain, loss of libido, gynecomastia, and erectile dysfunction. So most patients that we meet in clinical practice are worried about the sexual side effects. Now, having said that, the suppression of dihydrotestosterone is not that much, and here we have to calculate the risk versus benefit of this drug when it comes to the side effects. Say suppose 1000 patients are taking finasteride, only 2 people would get a sexual side effect, and that also is reversible. And even if they experience such kind of a side effect, it is reversible, because a lot of sexual behavior depends on multiple factors like environment, psychology of the patient, stress issues. There are a lot of other things that reduce libido. So finasteride is not the only one to blame. But if somebody is already on finasteride and they experience it, we stop it for a while and they can restart it, or we reduce the dose of finasteride. There are multiple options to tackle it. But that doesn't mean that you have to stop finasteride for these reasons. Finasteride and minoxidil, these two are the main medications that are FDA approved for treating androgenetic alopecia or male pattern baldness. And if you really want to see some efficacy, then you cannot avoid this too. Because whatever else is there like PRP or peptides or serums etc., those are adjuvant medications and not the main medications. So to sum up, finasteride is an absolutely safe medication. It doesn't have interactions with other drugs. Like suppose if you have diabetes or thyroid and you are on medications, it doesn't interfere with those medications. It doesn't interfere with food. You can take it before food, after food, doesn't interfere much with food. The incidence of side effects is very low. The safety profile is very good. And in case if you fit in that less than 2% patients who get a sexual side effect, then it's reversible. It's not irreversible. It can always be reversed and you are not going to suffer from anything.